I have a few things to say. Firstly, there's a parallel between Stockholm and New York. Stockholm also has a mayor that's a vegan and it's a plant-based diet, Karin Vangård. We invited her, but there are two setbacks. First, the mayor in Swedish cities are not responsible for healthcare. It's divisioned in another political branch, and we have invited also the politician from this branch, but she wasn't available. Also, we invited Sodexo Sweden to this panel, and they were very excited to come, and they wanted to bring one of their customers. In here in Stockholm, they are the food providers for the major hospitals, Danderyd and Karolinska, Huddinge and Solna. And but none of their customers were available to come, so they declined to be here in person, but they have answered some questions via mail. So while we are getting ready and everyone is getting into place, I can just tell what they are writing. The first question was if Sodexo Sweden has the capacity to transition or to facilitate a transition to plant-based diet in Swedish hospitals. And well, it's a long answer, but the short answer is yes. And I also asked if when Sodexo US has now paved the way, if this gives them an advantage, if they can exchange ideas and facilitate this similar transition in Swedish hospitals. And there's a long answer, but the short answer is yes. And she also writes that Sodexo Sweden is very positive to a change to plant-based diet for our common care for the planet and its resources. But my first question is to you, Samantha, and to everyone. What I would like to know, and which we won't have an answer to, is I mean, when I hear about what you've done in New York, it's like something taken from another planet. When I've worked with these issues for 10 years, and we have in Sweden 2 cardiology clinic who has worked very hard and managed to make this transition. And you have managed 11 hospitals. Would this even be possible in Sweden with the systems we have, etc.? Stella Cieszynski is from the cardiology clinic in Örebro. She talks very much about the importance of having everyone on board. And so my question to you, Samantha, is: Can you really have everyone on board in 11 hospitals? And weren't there a lot of protests? We've talked here today about hunters and employees with family in the dairy industry and meat industry who has been like furious. Has there been none of that in New York? No?
No, there hasn't. And we were sort of waiting for it, right? I think we were geared up and ready for that to happen, and it didn't. We did have, some questions internally from some folks. Listen, dietitians were questioning, and there's a variety of doctors out there, of physicians who are maybe not so familiar with the research in this arena, but from institutions and from lobbying groups and those bigger organizations that we would have thought, we have not. And I do think that that's also because of the support that we had from the top down. This has not been an approach where food and nutrition wanted to do this. We wanted to do this, but it was simultaneous, it was parallel to the government of New York City and the mayor really putting out the message that this is where we're going to go. And I think the other piece that's important is New York City as a whole, and New York City Health and Hospitals is part of a bigger agency, and we're just one of many agencies. So while the hospitals are also doing this, there are other agencies that are providing food to people that are doing this as well. So our public school system is also, they have plant-based Fridays and Mondays, I believe. I'm not an expert, and my children are not in New York City. So it's happening in other agencies along with just the hospitals. Our senior centers, it's happening. We have New York City food standards in which we have to abide by. And one of those is eliminating processed meats. And it was an executive order put in by the mayor. And the increased consumption and provisions of plant-based protein to our patients. So it's happening holistically as a city, not just from the hospitals. So when every which way you look, it's happening. Our children are speaking about it and hearing about it. Our elderly are hearing about it. And our hospitalized, middle-aged folks that are in the hospitals are also hearing about it. So I think that's also really important to note.
Excellent. I have questions for, I have questions for you too, but you can.
I would very much. Hello, Samantha. Stella Cisinski. I'm one of the physicians. I guess you can't see me, but anyway.
No.
No, it's quite
okay.
all right. It's not adding anything to the experience, I can assure you. Anyway, what I mean is that it's very impressive to listen to your enthusiasm and the way you're working. And I know that New York City and California is it's a more healthy population, isn't it? And also, if you went straight into, let's not say what kind of party that would be, but say it's a Republican area in Texas, would it be just as easy? Would you assume? I mean, would it be just a straightforward thing over there as well?
That's a good question. So I don't know that New York City is the healthiest population. I think California, it absolutely, listen, socioeconomic, the economy in which we live in within New York City versus California is very, very different. There's a lot of wealth in California, so I think we all presume that they're a healthy population. That's not the case in New York City. New York City has a variety and array of different populations. And again, our population is not those that are typically healthy. Our population is not those that typically have insurance and are able to go to the Whole Food Market, or they're going to the Green Market. They're the population that is going to the corner store and getting, the frozen or canned meat because it's the cheapest on the shelf. So from that perspective, we have done it with a population that I don't think people typically would have thought that we could have. Would it be difficult in Texas? Yeah, I think it will be difficult in Texas. And I think that's why you have to start somewhere, and you have to start small, and it doesn't have to be 100%, or, it doesn't have to be all or nothing. I think just starting on introducing it as one meal on one day, and then introducing it another meal another day, and slowly starting to expand. You have to understand who your audience is, and really develop a program that's going to fit their needs. But I do think that that's a very good point, that depending on which part of our country we're in, we're going to have some challenges. But New York City is one in which we are truly a melting pot, and we have everything. Republican, independent, Democrat, people that are wealthy, people that are not. And we've been able to do it.
One question to Christina and Stella. You are both operating managers of cardiology clinics since many years and have a good insight into the hospital system, who decides what. And can you see in the Swedish system something like this to happen? A whole hospital turning into plant-based diet as default?
Well, I think it's a very interesting idea. Like I said, I didn't actually ask anyone before we made this decision. I didn't discuss it with the politicians who sort of govern our county. In order to make it happen on a broader scale in all hospitals, in all schools, we discussed that a bit earlier, that it is difficult for some schools to provide a vegetarian or plant-based option. I think it will be, you will need to have the politicians on board. Like someone presented an opinion from a politician earlier, it's not always going to be so easy. But I wonder if you, Stella, have you ever discussed this with your politicians? What are they saying? Okay. Yeah.
To the States maybe is that actually nobody is taking a decision. Nobody's making a decision at all. So once you, I mean, if you want people to make a decision and sort of acknowledge what you're doing, then you might be waiting for 3 years before they have sort of ended all their research and meetings and sort of postponed the decision. So it's always better to just move on. The problem is when you have a total hospital, there will be no, I mean, you always speak about bottom-up decisions, but you definitely need a top-down decision as well. I mean, you, Samantha, you described the situation where you had your mayor with you. You need to have the people who are in the top with you. Otherwise, they will sabotage everything. So you just need them on board, definitely.
Yes.
Yes. We have Henrietta here, Lammes also on the board, who you talked about in your speak about nutrition to the elderly, that you gave an example of a politician where an elderly ward had changed once a week. They changed meat into soy protein, and the politicians were furious and said this was a horrible experiment and the suffering for the elderly, etc. And do you have any idea how to get this knowledge out? Because the facts is that even the elderly can thrive on a plant-based diet. That's what the science are telling us. But the politicians and many hospital care workers have the opposite view, an idea that comes from God knows what, that they will perish and die.
I don't have any exact plan or so, but I think you have to work in many different ways. We have been talking about or thinking about patients' associations. That is more for specific diseases, of course. But I think you just have to keep repeating this information for as many as possible. But it's not very easy, because where I work, we have been trying to establish an association for nutrition within our county. And that's been ongoing since 2018, and we still don't have anybody who has really given us the right to make any decisions or to start to work. Because there is no real interest, and then came the pandemic, so the only person we were working with, he just left it all out. And somebody takes a new step and then it stops. And yeah, I think we just have to keep working until enough people know about it and have heard, and then maybe it starts spreading more.
Could I add something to that? I think that's the society today in Sweden, at least, is so overwhelmed with conflicting ideas all the time, and people are sort of developing some kind of they just want to keep things away from them. They're suffering from over-information and overwhelming decision-making about everything. They're stressed. So that applies very much also to the healthcare system. So you have difficulties in establishing enthusiasm in the professional group. I mean, you cannot make people sort of behave more enthusiastic about new things, which is strange. This is not the way you think things were, Samantha. I guess you have some kind of ideas about how things are in Sweden. We have always been forward, and we have always been very equal, and we have been doing a lot of interesting things. And I don't know, I think we have sort of lost that energy, and we need to get it back.
If I could also add, I think for us, the guidelines are also behind, right? So for people, for healthcare professionals that are naysayers, or they're not sure, and they're not willing, or they are not able to really dig into the research themselves, they always go to the established guidelines. And within nutrition, alone, the established guidelines are still pointing us towards increase protein, where you're getting that protein from, where the research is showing us that the guidelines are a little bit off and they have to be updated. So I think healthcare in general, and the institutions and the academies that govern how we all provide care to our patients need to sort of step up a bit also, and share with us what is currently happening with the evidence and the research.
Excellent. Is there any burning question from the audience? Or I would like to say thank you, Samantha. It was fantastic, and the work you've done in New York is a great inspiration. And I think we're asking ourselves here, what can be done here to accomplish something similar? And I think just having this conference, we're recording this session, and we'll make sure it will be seen by kostchefer, I don't know the English word, the operating manager of nutrition departments in hospitals. And hopefully one or two politicians will read the China study or my book and something, and start springing into action. But thank you very much for your time. And well, let's put our hands together for the panel and Samantha. Thank you very much.
Thank you so much.